All right, we are live. So happy Tuesday, everyone. It feels great to be back. Yesterday was a little bit strange being on Monday, but if you didn't catch our live with Nurse Barb and Dr. Yen, it was really awesome, really informative. So definitely check that out. It's still on our Facebook and YouTube channels. YouTube, actually, you can like scroll through the whole thing. So check it out there. But tonight we are back on our usual grind with the Trendy Tuesday Q&A. As usual, I am joined by Dr. Sophia Yen, CEO and co-founder of Pandia Health. She is also an adolescent medicine doctor. And tonight we are going to be discussing STI awareness, prevention, and treatment, kind of all things encapsulated into these main 4 questions that are trending online. So, oh, thank you for adding that, the banner. I will add the other one. Without further ado, our first question for tonight, pretty basic, getting into it, is what are the main STIs that someone can get, and what are some signs that you might have contracted one?
So the number one diagnosed STI, sexually transmitted infection, is chlamydia. And the reason for that is the number one sexually transmitted infection, HPV, human papillomavirus. There is no test for human papillomavirus commercially available to Joe Blow, anybody on the street, or even if your doctor tries to order it, for those with penises. And so that's why that one is the most prevalent, meaning a lot of people have this disease or infection, but people don't know, because if you can't test for it, then you don't know. There is only tests for those with penises in like special research studies. So if you haven't signed a consent to being part of a research study, then you have not been tested for HPV if you have a penis, those of you with penises. So human papilloma virus. For those of us with uteruses, we only test for human papillomavirus when we get a pap smear. And even then, the doctor or prescriber or whoever has to ask specifically for an HPV test. But when you get an abnormal pap smear, it's 99.9999% of the time because you have HPV. Human papillomavirus. And human papillomavirus can, 1, cause cervical cancer. That's why we're doing the pap smear. But it can also, 2, cause genital warts. And then 3, actually finger warts too. And so just warts in general. There's 160 different types of HPV viruses, and they're all in the same family. And there's a vaccine that covers 9, but that leaves you 151 ones that it doesn't cover. And the one that covers 9 is pretty awesome in that it covers 90% of the HPV that currently causes cervical cancer. And it also covers 90% of the HPV that causes warts. So it's a no-brainer, just get the vaccine. And there's probably some cross coverage so that, if you're covered for these 9, I'll cover you for the other, but they just haven't, checked or tested for all the other ones. So you still need to get a PAP in the United States at age 21. In the old days, it used to be as soon as you have sex. And then we turned it into 3 years after you'd had sex. And then we just came up with the cutoff of 21 years old. So that is the number one sexually transmitted infection. And again, there's no test for it in a person with a penis. Even if you were to bring a penis to me and be like, Dr. Yen, check it out. And I'd look at it and I go, that's the cleanest penis I've ever seen. And then you had sex with it. And then 2 weeks later, bloop, 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 you got some external warts or you got an abnormal pap smear. I'd be like, oops. Because we only call HPV when we see it. So only if there's a wart there can I be like, oh, yeah, definitely HPV. But I can't tell you, oh, no, definitely not HPV, unless we sandpaper it, sign a consent for a research study and send it off to the lab, which, again, only if I were running the research study and I got the protocol and the permissions and all that to do. Right now, the only ones that can be tested are those of us with uteris and vaginas. And then for those with penises wondering, well, can I just stick in a speculum and look around in the vagina to see if I can find HPV? The vagina is like a collapsed balloon, And so when I go in there, I stretch it out. But there's all these little rugae and nooks and crannies in the corner that I cannot see the whole thing. And if I use a metal speculum, which is nice because it's strong, I can't see where the metal's blocking. And then if I use a plastic one, which lights up, still there are corners and wrinkles unless I like blew it up. And then even then, there's like, it'd be microscopic. That's the point is you can't know. And I just say, assume everyone has every sexually transmitted infections unless you were both virgins coming in and no one had been sexually assaulted. Mm-hmm. Okay. So that's the number one. Number two is chlamydia. And chlamydia can be silent and not deadly, but cause infertility. So I think something like 80% of men who have chlamydia have no idea. And so those with penises. And so what we suggest is anybody under the age of 26 who's heterosexually active, or men who have sex with men, but not those uteri having sex with uteri, unless they've had some hetero mixed in there at some point, should be tested for chlamydia once a year if you're having any sexual relations. Okay. Because a whole bunch of people that have it have no clue that they have it. And then when the person with the uterus is trying to get pregnant, when they're like 30 and they're having a hard time, they'll like check some chlamydia antibodies and they'll be like, oh, you had chlamydia. And you're like, I had no symptoms, I had no signs, but that was like 10, 20 years ago. And meanwhile, inflammation and now infertility. So if you are 26 or under and having heterosexual relations or blah, 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 get checked once a year at the very least for chlamydia. Mm-hmm. And then there's herpes, which is very prevalent. And the reason why is because there's mouth herpes and then there's sexual herpes. The problem is this is usually HSV1 and then down there is HSV2. But now with a ton of oral sex going around, you can have HSV1 down there, HSV2 up here. If you're doing oral sex and you stick the thing in, then you get contaminated. And then you get HSV2, or you got oral sores, and then you go down on that, and then that goes into you. Then you just gave yourself herpes number 1 down there. So, and the key with herpes is there is certainly a test where you can like, oh, here's the lesion, because herpes, it's the same family as chickenpox. So it's a little like zit, but without white pus. It's clear, and it pops. And then the bottom is like painful and kind of stuff like that. But sometimes it's so small and you didn't notice it that you thought you nicked yourself zipping up your zipper or something is the most common one we've heard. And again, like 80% of the people you survey who have a positive HSV, herpes simplex virus, have no recollection of when, how, whatever. And the problem with herpes is it's your friend for life. Yeah. Once you get it, it's never going away. And it will go away a little bit, but if you get stressed out, it'll come back out and say hello. And you can pass it at any time. And that's a problem because once you get it, it's your friend for life. And you're also infecting people for the rest of your life. And it would be a good person on you if you have herpes that you tell every sexual partner that you have so that you don't give them something that they weren't expecting. Or again, I just say use a condom at all times. Just, assume everybody has everything. And then there's no guilt and there's nothing on anybody. You could, no questions asked because you both wore a condom and you tried to, protect yourselves from the situation. But if you have herpes, even with a condom could break, could pop, blah, blah. And you wouldn't want to be responsible for giving somebody herpes that you didn't give them a heads up. For herpes, the best test is a blood test. And most physicians will not order it as a screening test or whatever, because technically it's not medically indicated. But some people will order it if you've had sores and they want to check and kind of, advise you against oral sex, or at least oral sex without a condom. So know that there are flavored condoms out there. Know that you can take a flavored condom, splay it open, and use it as a dental dam, because the dental dams are kind of thick, but they're also flavored dental dams if you're doing oral sex like that. So you can splay a condom and have flavor. Woohoo! Right. So that's herpes. And then gonorrhea is the old school. I think it's called the drip. And so it hits you fast and hard. And so you get exposed to it. And then like in 3 to 7 days, nasty kind of discharge. People with gonorrhea do not know they have gonorrhea. The other crazy part is if you have oral sex with gonorrhea, you can get oral gonorrhea. So if you have a sore throat after having oral sex and it lasts and there's nasty discharge, you don't have strep, you might have gonorrhea. And you have to tell the doctor, please check for gonorrhea, because gonorrhea is a very specific bacteria. And we have to send it to the lab in the old days in a special way. We even had to put it in a jar, throw in a match so the match would eat up all the oxygen and close it and then send it to the lab. But now we have, I realize, a DNA test. But you still got to tell the doctor, because if they don't check for gonorrhea the way we normally grow the bacteria, it's going to be dead by the time it gets to the lab. So, but if we do a DNA test, if it's dead, it's fine. But we got to do the DNA test. So that is the other key caveat with sexually transmitted infections. Just because somebody shows you they have a negative STI test, it's only negative for that thing that they have in front of you. So not like, because I have a lot of people, they're trying to be healthy and responsible and like, we're going to have sex, test us up for everything. And it's like, well, one, I don't know if your insurance is going to cover everything. Mm-hmm. And two, we are, I'll get knocked as a doctor if I test you for everything, because there's only certain stuff we screen for if you have no symptoms, no discharge, no nothing. And that would be generally chlamydia and HIV. So we aren't testing for herpes. We aren't testing for HPV. Again, as I mentioned, no test for those with penises for HPV. It doesn't exist except for in a lab. And then the warts, again, we only call it when we see it. Hepatitis B and hepatitis C. Most of us should have been vaccinated against hepatitis B, but hepatitis C is sexually and blood transmitted. And so if you have sex with somebody with hepatitis C, we rarely test for that. And then HIV is limited. It tells you 6 weeks before this test, they had HIV negative, because what we're testing for is the antibody. And it takes up to 6 weeks for some people for that antibody to get up there. So just because you have a negative HIV test in front of you says 6 weeks before they took this, they were negative. And unless you were with that person 24/7 since they took that blood test and 6 weeks before that, then you don't know. So again, just assume everyone has every sexually transmitted infection under the sun. And the benefit for those of us with uteri is I don't want to leak semen for 24 hours. Mm-hmm. And there's even a colleague who's made a stick that you can stick up your vagina that sucks up that semen and takes it away. But I was like, why not just use a condom? Because I can protect against sexually transmitted infections and they take the semen away,
Solves that in the first place.
Two for one.
Yes. I think Nurse Barb made a really good point in our live yesterday, and we were talking about how to start the conversation with your partner about STI testing, because it can be a little uncomfortable, especially if you're with a new partner. But the first thing she pointed out was that if someone is not willing to get an STI test for you, then maybe that's a red flag, and maybe that's not a step that you're ready to take in having sex with this person. And then the second thing she mentioned was just kind of an easy script that you can follow, and you can check out her website, nursebarb.com. But I know she mentioned saying like, hey, like, I think I really like where this relationship is going, but if we do want to take it to that next step, in order for us to just both be safe, have that clear conscience, how about we just get tested together, or go and, record our experiences, all of that. And it can be like almost a fun date. With COVID, there's not a lot we can do anyway in terms of dates, so might as well. But I thought that was a really good point. And then also just making sure to wear condoms. We have a collab with One Condoms where you can get a nice little sampler pack with also different types of lubes, and they have really good water-based lube that just like is not irritating, and would highly recommend. So check that out. We also got a really good question asking, why do men not get HPV?
So men absolutely get HPV. And we believe that men are giving it to women, obviously. And in India, oddly enough, I think it's a genetic thing, when men in India get HPV, they have a much greater rate of penile cancer. And so it's absolutely in their interest to get the HPV vaccine. It's just that we don't have a commercially available test for HPV in men. And it's just because I guess they don't get penile cancer as often, and maybe it happens more in uncircumcised because there's more surface area for the HPV to mutate into cancer. I'm not sure, but it's just someone needs to develop that test, or just probably what we use for women's HPV tests. I mean, it's because we're looking for cervical cancer. We're not looking in the vagina because there's just a ton of surface area. And the same thing with the penis. Like, do we swab the head? Do we swab all the foreskin? Like, where would be swabbing to get the right sample for HPV? Whereas when we're checking women for HPV, we're checking the cervix because we only care about cervical cancer. And again, maybe it's not in the cervix when we check for it. And instead it's in the vagina and you have sex with that. And then you got penile cancer, you got penile warts. So again, just assume everybody has it. But the one way we do detect it is in the pap smear for women.
Yeah, that makes sense. And then I just realized, is it called the pap smear because it's testing for human papillomavirus? Oh, it makes so much sense.
Well, actually, it's called the pap smear because it's Dr. Papanicolaou.
Oh, well, makes sense.
Yes. So sorry, but I love the fact that you picked up on the similarity. And I almost went with that. But no, it's Papanicolaou is the professor, the doctor. I know, like, when you name a disease after yourself, do you want people to hate your last name for the rest of your life?
Right, and especially one that's not so great. But yeah, oh yeah, Ariana, never knew that was why that was called the pap smear. Yeah, me either. My dad also left a comment. Thanks for watching. And he said that was a really descriptive explanation, and it was. And I really appreciate that myself. And I'm sure like anyone else who sees this is probably like, wait, I had no idea about all of that.
The human body that's why I'm a doctor, is the human body is so amazing, so fascinating that we start from, you know, a sperm and an egg that comes together and then divides and then it turns to all these different things. And then that each one cell has the information to make an entire other human being. And then just like for me, the reason why I went into adolescent medicine was I liked outpatient gynecology and specifically the pap smear, in that you stick in the speculum and then bloop, the cervix pops into view and you're like, ha-ha, and then you like, and then you send it off. Not a pleasant experience for the woman, but like it was kind of like a hunt, you know, and if you got it right, you got it. And if you didn't, then you had to hunt for it. And that was not a happy situation.
Right. But you get it. And,
and I think that most people don't understand the vagina, right? It's just a place you stick things in. But for me to stick a speculum, I'm seeing all the nooks and crannies.
It's hard. Only like a mirror can show you so much. So like you're not getting that deep of a view. But it just goes to show that, yeah, the human body is very complex, but it's really amazing that we can do all these things with it. And so going off of kind of all of that, obviously getting an STI is not a pleasant experience. But as you mentioned, most of them are treatable, curable. I don't know if that's for all of them or just some of them, but we can kind of discuss. So if someone thinks they have an STI or they just got diagnosed with one, what would kind of the next course of action be? Because it happens, unfortunately.
Okay. So I just put the one condom deal that we have, bit.ly/capital Pandia, capital one, all one together. With respect to sexually transmitted infections, if you think you have a sexually transmitted infection, go get tested. And according to your symptoms, etc., the physician or provider will order the correct exam, tests, hopefully. If you turn positive for chlamydia, if you turn positive for any sexually transmitted infection, then we generally check you for all the other ones, because if you caught one, you could have caught others. Then if you're positive for chlamydia, they'll definitely check you for gonorrhea. They'll offer you HIV. And in the old days, we'd also check for syphilis as well. Syphilis is a blood test, as is oftentimes HIV, though you can do it with a cheek swab. If you have chlamydia, then we just treat it with some antibiotics. And if you have gonorrhea, we also treat it with antibiotics, though I think we may be limiting it to a shot. So if you get gonorrhea, you're going to need a shot. And then for HIV, that's a whole, totally different thing. For HPV with abnormal pap smears, we follow it up with other kind of pap smears. And then if it's, we do HPV testing. If it's high risk HPV, then we follow it up more quickly. We can also do something called colposcopy, where we paint the cervix with literally vinegar, and then it'll light up in white spots where HPV is. And in the old days, we would like chomp out that part and send it off to the lab to check if the borders had cancer or stuff like that. I don't know if they're still doing that. And as we mentioned, herpes is your friend for life. There is no cure.
Gotcha.
And HIV is also your friend for life. There is no cure. And we do have a ton of medications you can treat HIV with, and you'll live 40 years, whereas in the past, you'd like die in 5 or 12 years, and Kaposi sarcoma and PCP pneumonia, et cetera, and low immune system. But now we got drugs that'll last it out. But it is a death sentence in that we currently have no cure. And it's a brilliant virus in that it attacks your immune system, whose whole job it is to get rid of viruses. So that is a hard one. Syphilis is not that common, but it is, out there. And it is, as you may or may not know, Napoleon there's different levels of syphilis. There's primary syphilis, secondary syphilis, and tertiary syphilis. And primary syphilis is a chancre, a painless ulcer, can be on your tongue. If you did oral sex, Google that, crazy pictures. Can be on your penis, can be on your vagina, can be on your labia. And if it's inside and it's painless, the vagina is a deep, dark thing. You will not know that it's in there. And if you stick your penis in there, it will touch things it won't know because it's penising, And so that's primary. Secondary is when it spreads throughout the body. And so if you have a rash, syphilis is a great mimicker. And whenever there's a wacky rash, the doctor may check for syphilis because it could be syphilis, and particularly in a sexually active person. And then tertiary syphilis is when the spirochetes have gone to your brain. And so that's where they thought Napoleon happened, is he got like crazy of the brain from syphilis. And you get these grandiose ideas that you're amazing and you're strong and you're powerful. And he was, but sometimes, when you're not. And then, but there are epidemics of syphilis and there are epidemics of gonorrhea, I think in a retirement home, because we forget that, old people are sexually active. And particularly in a retirement home, oftentimes there's one male with a penis and a whole bunch of uteri who, and so it's one male and a whole bunch of uteri. And so if one of these gets it from somewhere and brings it in and then then la. And then there was also, I believe in like Georgia or Florida, a bunch of cheerleaders spread around some gonorrhea. So, and then we've also seen in, I think, Oakland, some either gonorrhea or syphilis. I saw secondary syphilis, not tertiary syphilis. So we test all babies for syphilis because if they do, it's important to catch. We also test them, I believe, for gonorrhea because if they get in their eye, then they can go blind. And that's why we put eye drops in kids as soon as they're born, just to prevent it in case. But this one kid tested the newborn baby, because I'm a pediatrician, and we checked the newborn baby, had syphilis. And then we looked at the mom, and the mom had these palms and soles rash. She had syphilis. And so we're like, oh, syphilis.
The movie I watched in high school for them to kind of scare us in health class about STIs was about syphilis. And I remember we knew it had happened because the girl was like, brushing her teeth after she'd had oral sex with the bad guy. And then she like feels something in her mouth, and then everyone in the school got it. Yeah, really, it was actually a good way because I was really scared. So it worked for me. Don't know if it works for everyone, but yeah, something to keep in mind. So while it's less common, it does still exist. So
yes, you should. I had a sexually transmitted infection atlas in my office, and I think that everyone should have one in their office, because once you look through that and you're like, warts, chancre, herpes, like, condom, always condom.
Yeah, definitely. Last two things, a quick question that we just got. I don't know if you know the answer to this question, but kind of like very brief history of STIs? Yeah, I feel like we don't know. I remember in health class, even someone asked that question because they were so scared. They were like, who started this? And I feel like it's one of those things where you don't know either, because it's like, did that person already have it? Did they contract it from? So
did it come from an animal, or did it just randomly mutate? Right. I mean, we evolved, and we are some very complex beings. Right. And so in our bodies and over time, things evolve. And so oftentimes bad things, I think HIV might have, I think was related to monkeys or something, simian virus or something. I, again, am totally wrong. We have to Google all this. But one is we always blame somebody having sex with an animal. So don't have sex with animals. And two, just random mutations happen and things evolve, just like we evolved out of amoeba to where we are today, you know, or whatever, one cell organisms, diseases evolve.
Yeah. Fair enough. Solid answer for that. And then the last question, which actually shout out to Ariana, because I think this really brings everything kind of home to our purpose of birth control and providing women with expert care, specifically as it relates to contraception. And if someone is getting treatment for an STI, will that, and they're on birth control, will that and have that any impact on the effectiveness of their birth control?
That is a great question. I would say that if you're on the copper IUD, no, it won't have any effect. If you're on an IUD with hormone or an implant, I don't think an IUD with hormone because it's local in your uterus and the antibiotics is going through your gut situation. The implant, same thing. It's going through your body, not through there. The shot, the same thing. But the patch, no. The ring, going through your vagina. So with the birth control pill, we always say that with any antibiotics, it may affect your birth control. And so again, I'm paranoid. I don't want anybody being pregnant that doesn't want to be pregnant. So in general, I think they say use a backup for while you're on the antibiotics plus a week. And to be really anal, I'd make it 2 weeks. And again, you should be using condoms anyway. And if you just have a sexually transmitted infection, you really should be using condoms.
Yeah.
So that would be the answer, is that if you're on the pill, most like there is a theoretical risk of decreasing the efficacy of your birth control with the antibiotics. Though in true research, it's only been shown with rifampin, which is a tuberculosis drug, and griseofulvin, which is an anti-head fungus or toenail fungus drug. And you would know if you were on either of those two drugs. But there's also this thing called enterohepatic cycling of the hormones. Entero meaning your GI system, hepatic meaning your liver. And if you throw antibiotics and that messes it up, and so that enterohepatic cycling doesn't happen, and then maybe your level of estrogen and progesterone in your blood is lower than usual, so your antibiotic might not work. But we also recommend abstaining from sex for chlamydia until 2 weeks after the last person's treated. So let's say I was detected with chlamydia. We don't know who gave it to whom. And then I got treated. Then I told my partner, they got treated. We'd have to wait until whoever the second person is got treated plus, I think 2 weeks to be safe, because it takes that long to kill it and clear it. Otherwise, if you have unprotected sex before then, so let's say I get treated and he's not treated, well, then I'm going to catch it back. Or I get treated and he gets treated, but it's not been 2 weeks. And then we bring it back because it isn't fully killed.
Yeah, sigh. Long story short, I think it's just easier to use condoms and just have that honesty with your partner and also with your healthcare provider. If you don't exactly know where to start, I know Planned Parenthood is a great option. We even have an FAQ section on our website specifically about STIs. I know Dr. Yen said she takes like all the questions she sees trending or she gets and puts it into that section. So it's we have a lot of information in there, not just on STIs, but on everything under the sun related to reproductive health. So that's pretty much it for tonight. Thank you all for the questions and just asking and being curious about all of these topics. I think the more we open up the conversation and kind of normalize, I don't want to say normalize STIs because it is still something that should be taken very seriously, but normalizing treatment and having that conversation, I think, is really important and can hopefully just make it maybe less common, less prevalent, all of those things. So I am really glad we were talking about this, especially as we move into post-COVID times. And I feel like maybe more people are going to be getting together. You don't know where other people have been. So I feel like this is a good timing for this topic. Do you have any final words of wisdom before we head out for the evening?
Assume everybody has every STI under the sun. Use a condom. A condom is awesome. There are good condoms. Go to condomdepot.com. They should pay me. And they have it rated by person with penis said, person with vagina said, and pick the best one for penis or vagina according to your preference.
Yeah. Yeah, absolutely. And there's all different ones. So if one gives you like an allergy or something, you can just try something else, and kind of like with birth control. We talked about that last night. But yeah, I like that final topic. And as my dad wrote, he liked that you said penising. That's hilarious. I've never heard that saying, but like, you're right. Like, you don't know what's going on in there. Like, once it's in there, I don't know.
It doesn't know what it's touching. You can't see it. You can't see through your penis. You can't. Your penis doesn't have eyes.
No. Yeah.
And if it did, I would be concerned.
Yeah, then maybe go to the doctor, a healthcare practitioner.
Maybe you got ulcers, Shanker.
Right. We don't want that. But yeah, this was really great. I'm glad we discussed this topic again in like ending COVID times. I think this is really important as people are starting to get together again. Yeah, so that was it for tonight. Thank you all again for joining. We will be back, maybe not next week, but throughout the rest of the month. So stay tuned. We'll have some lives sprinkled in, hopefully related to like safe sex in the summer, some fun topics going forward. You'll see hopefully some other faces from Pandia Health. But thank you so much, Dr. Yen, for joining me this evening. And I hope everyone has a safe rest of their night. Enjoy the warm weather if it's warm where you are. And be safe as always. Have a good one.